Good afternoon. If you're just joining us, you are just in time for Africa Speaks, KTN's show where Kenya speaks to Africa. I'm John Allen Amu, standing in for Joy Doreen Bira. She's on a bit of a holiday, but she'll be back soon. Now, this week on Africa Speaks, we unfortunately are discussing a disease, a virus that has been a scourge to the African continent for decades now. It's inspired books, it's inspired films, and unfortunately now it's back in Western Africa, Sierra Leone, Liberia, Nigeria, just a few of the countries affected with just under 800 people dead. We, of course, are talking about the Ebola virus. We've got two experts from Kenya's Ministry of Health and Port Services that are going to be speaking to us today about what the efforts of Kenya are in mitigating any effects of this virus spreading towards Kenya, as well as what's going on on the continent. That, of course, is coming up in a few minutes on the platform. But first, to our first segment, Web City. We're taking a look at some of the stories that have been making news across the continent. Unfortunately, two stories, two different countries, two different tragedies. And here is Web City with the stories from the week. UN have requested donors to increase funding to avoid a looming famine in South Sudan. An estimated 1 million children aged under 5 years face acute malnutrition in the young nation unless urgent measures are put in place. According to aid agencies, 50,000 children could die from malnutrition this year. In a joint statement released by the World Food Programme and UNICEF, the two bodies asked the world not to allow a repeat of what occurred in Somalia and the Horn of Africa region in 2011, when early warnings of impending hunger and malnutrition went largely unheeded until official famine levels were announced. A Somali member of parliament has been killed in the restless capital, Mogadishu. Aden Madir, who was the chairman of the Parliamentary Finance Committee, was gunned down outside a mosque in the Hamarwein district shortly after attending Friday prayers. Madir is the fifth MP to have been killed in the last 4 months, among those dead being popular musician and MP Saado Ali Warsame. The militant group Al-Shabaab has claimed responsibility for the deaths of the legislators. The group says it will target all those who it perceives to support the UN-backed government. However, other MPs say the killings won't deter them in carrying out their national duties.
On Click, we share some of the images from Rwanda and the rest of the world about Rwanda in 1994.
Beg your pardon, just channeling Joy Doreen Bira there from last week's segment of Click. But on this week's segment of Click, we take a look at a rather inauspicious day. Now, if you were 32 years old or celebrating your 32nd birthday, if you celebrated it yesterday, then happy birthday to you. But unfortunately, if you're in Kenya, then you shared a birthday with a rather inauspicious day in our history. August the 1st, of course, being the date of the second coup in Kenya, the second failed coup. But there have been lots of other coups around Africa. Let's take a look at some of the coups that have taken place around Africa over the past 50 years or so. Let's start with Nigeria. Now, Nigeria has had a number of coups, in fact, 14 coup attempts in its independent history between 1962 and 2004. And successful coup leaders, if you've been to Lagos, then you know the name Murtala Mohammed. He was the first one. And others include Liberia, another country that has had 13 coup attempts between 1980 and 2003. First coup by Major Sergeant Samuel Doe, dying a very painful death if you know about African history. Finally, like I said, most inauspicious date in Kenyan history, perhaps August the 1st, but there have been one other coup attempt. There's one on 8th of April 1970, much less known about, and the other, of course, 1st of August, lasted about 2-3 days before it was crushed by the army, led by Kenya Air Force soldiers. All right, now we're going to go into our segment to discuss Ebola. This segment, of course, is called The Platform. Here it is. Now, if you're just joining us, this is the platform on KTN Africa Speaks. And today, like I mentioned earlier, we're discussing the virus that has been a scourge to Africa for quite a number of years, starting in Sudan and the Congo. That, of course, is the Ebola virus. And here to discuss it with me today, I have two guests. I've got Dr. Shikanga Otipo to my immediate left. He is a medical epidemiologist and the acting head of the Disease and Surveillance and Outbreak Response Unit in the Ministry of Health. Thank you for joining us, Dr. Otipo. And we've got Mr. Sami Makama. He's the head of the Ports Health Services Unit. Thank you both for joining us on the program Africa Speaks. I'll start with you, Dr. Otipo. Just a quick explanation, because people have created this very interesting imagery about what Ebola is. Very quickly, what is Ebola?
Thank you, Alan. Now, Ebola is a viral disease caused by the virus that we call the Ebola virus. It's a highly infectious virus, meaning it easily jumps from person to person. And it's also quite lethal because it kills at times up to 90% of the people that it infects.
90%, that's a very big number. How does it spread though?
Yeah, that's a good question, Alan, because people need to know that unlike other viruses like common cold virus, which can jump from person to person through the air, the Ebola virus jumps from person to person or from where it stays in nature to human beings, usually by contact. Just getting in contact with either blood or body fluids of an infected person. And the body fluid might actually be urine, vomitus, stool, and even sweat from an infected person. So
to dispel a myth, if I shook your hand like this, could I be susceptible to the Ebola virus if you had it or you were carrying it?
Yes, that is the route of transmission from person to person, from an infected person to a person who is not infected. That's contact.
Is it curable?
Now, it is not curable if we understand the term cure, what it means, that you will dispel or offer a drug that will take away the virus. At the moment in time, there is no known cure for Ebola virus. Yes.
Definitely something very scary. We're talking about the Ebola virus today on Africa Speaks. Of course, you can join the conversation on our Twitter handle at KTN Africa Speaks. The hashtag is hashtag Africa Speaks. The other hashtag that you can use to communicate with us and join us in this discussion is, of course, Ebola. You can tweet me also on my own personal Twitter handle. That's at John Allen Namu. Now, Mr. Makama, just going back into this discussion about how Ebola spreads. When managing ports of entry into a country like Kenya's, what would the first thing be when you're trying to stop the spread of a virus that spreads as quickly as Dr. Otipo just explained?
Thank you very much. Our Port Health Services Unit in the Ministry of Health has a responsibility of ensuring that we prevent any communication of possible diseases and other public health conditions from outside the country. Now we have very well trained officers manning all the points of entry into the country. This include airports, ports, and ground crossings. Now currently one of our main focus is to prevent the spread of Ebola into the country. And we have put a number of measures in place at all our points of entry.
Just hold that thought before we talk about Kenya. Let's talk about the current problem that's happening in the west of Africa. Of course, Sierra Leone bearing the highest burden. Dr. Otipo, what do you know about the issues there?
Well, I happened to participate in the initial international response where I spent about a month in Liberia in April this year.
Yes.
And yes, I know there are a number of issues out there. Alan, let's note that in the history of Ebola that we know of, this is the most severe outbreak known in record, because it has taken so long to interrupt transmission and put it a stop. And then secondly, it's causing so many deaths. And now thirdly, the first outbreak that's affecting multiple, up to 4 countries all at once. Now, there are a number of issues that could be behind this, but key amongst them is the health systems. It's important that countries actually prepare the health systems for such outbreaks. So
just explain to us what the health system is in Liberia, in Sierra Leone, so that we can get an understanding from at least a Kenyan and East African perspective if we have similar health structures or we are better off.
Health systems will have a number of components, Alan. But key amongst them is ensuring that we have the right health infrastructure in place, hospitals where they need to be for ease of access by the population. Then secondly, we are talking about adequate numbers of well-trained and well-prepared health personnel, because when a condition like Ebola strikes, you want your health infrastructure to pick it up, your health system to pick it up at the earliest opportunity.
Immediately.
Yeah, so that we can have a lead time in response.
Did that obviously didn't happen in Sierra Leone, Liberia.
Yes.
What are the mitigations there now?
Now, at the moment, yes, we have a full force of international response teams, which is doing a wonderful job at the moment. We have laboratories that have been moved to closer to the communities where this is happening for ease of confirmation, because you want to confirm rapidly and confine these patients if need be, so that we can interrupt transmission to other people.
Yeah.
There's a lot of health education in the community that has been ongoing ever since March. There is provision of health commodities that will be required in the management, for example, constructing isolation facilities, having ambulance services in place, and the right ambulances, Alan, because not just any ambulance will do, because you want as much as possible to avoid unnecessary exposure of even health personnel.
Okay, before I go to you, Mr. Makama, you've seen people pass on because of Ebola, out of the symptoms of Ebola and how it manifests. Just very quickly, tell us, what should I look out for if I'm looking for a person, if I come across a person who I think has Ebola?
Yeah, that's a good question, Alan. Traditionally, we know Ebola to present with hemorrhage, with bleeding. But lately, in the about 3 or so latest outbreaks globally, we are seeing less and less of bleeding. In fact, much less than half the patients usually bleed. So the commonest sign that we always look for is fever, just hotness of the body, either reported or as we measure it when the patient presents to us. Then flu-like symptoms with sneezing, with nasal discharge, with soreness in the throat, often coughing, at times diarrhea, most importantly, headache, muscle pains and bone pains, and then malaise or fatigue, easy fatigability.
That could be confused with malaria. Let me just move on to you, Mr. Makama. What are the mitigations that we have here? What things have we put in place to ensure that those kinds of symptoms, which can quite honestly be confused with malaria, are caught early enough?
Yeah. When we got this communication about the outbreak in West Africa in March, we communicated to all our health staff who are manning the various points of entry, gave them all the information about the trends of the disease in the 3 countries in West Africa. And then secondly, we have equipped them with adequate protective gear to be able to use when they are addressing this issue and whenever they get any suspected case. Now, at the points of entry, there is a screening going on. For example, in Jomo Kenyatta International Airport, all flights originating from West African countries, immediately the passengers disembark, they go through a screening process.
Yes.
They fill a form which has details on their contacts, and then they also, through the form, they are able to tick whether they have any of the signs and symptoms of this disease, as explained by my colleague.
Okay, would that include the Sierra Leonean national football team? We're just getting news that they are still in the country, coming in a couple of days ago.
Yeah, they have also been screened like any other passenger from West African countries. And we have quite a high volume of passengers from these countries. On a weekly basis, we get about 68 flights operated by different airlines into the country.
If I understand this correctly, and Dr. Otipo, you can chime in, the incubation period for Ebola is 21 days, right? So is it 21 days before I move on?
It's not quite 21 days. It's 2 days to
2 days to 21
days, yes.
So within the range of 2 to 21, if a person doesn't present at the airport and gets into the country, how then do we track that person's movement, Mr. Makama?
Once a passenger has gone through the airport system and has been screened, they do leave the contacts, their contacts, where they are going, where they're going to stay, and the contacts of their hosts. So in case we need to track any of the passengers who passed through because of some reasons which may have developed later, then we'll be able to use those contacts and get to the person, wherever the person is within the country.
All right, very heavy discussion happening here about the outbreak and the spread of Ebola, the Ebola virus in Western Africa. As Dr. Otipo explains, the worst outbreak of Ebola on this continent since the disease was first discovered, so to speak. The hashtags that you can reach us on are hashtag Ebola and hashtag KTN Africa Speaks. Tweet me on my handle at John Alanamu. Let's hear what you have to say about this very serious viral disease that our brothers in Western Africa are currently challenged with trying to mitigate against. Now back to you, Mr. Makama. Just following up on the Sierra Leonean case, was it that important that they transit through our country? The Seychellois, who they were playing in the African Nations qualifying match, have forfeited the match. Would rather lose an opportunity to be represented on that continental stage for football, rather than have a team like that, or rather from that country, get into their own country. And these people are currently transiting through Kenya. Not to sound as if we are trying to bar our brothers and sisters from coming here, but how seriously are we taking steps to ensure that there are advisories for people traveling from these countries?
First, I want to mention that there is no travel restriction so far on anybody from West Africa to any country. We normally follow guidelines as issued by the World Health Organization, and up to now, they still have not issued any travel restriction. So they are actually advising people to move freely. But despite that, we have put a lot of measures in place, as I have mentioned. For example, this Sierra Leone team, we have all their details of the 17 players. Although not all of them originated from Sierra Leone, they have some of their team members who are playing professional football in Europe, so they flew in directly from Europe. So the team is somehow was confined somewhere, so the risks are reduced because of that confinement. And as I mentioned earlier, we still have very many travelers coming in through the 68 weekly flights operated by various airlines. And we keep track of all the travelers from West Africa.
All right, just before I get to you, Dr. Otipo.
Alan, I just wanted to augment what my colleague has said.
Yes.
We know, science knows that before someone turns symptomatic, they cannot transmit the virus to someone else. So like for these players, we've assessed them and none of them is symptomatic so far. So we wouldn't worry because they cannot transmit to anyone else. And so, and again, for the public good, it's good for me to just reinforce this, that at this moment in time, we do not have Ebola in Kenya. We are Ebola free and we are on top of things, and we wouldn't worry excessively about this team, this soccer team in the country, because we know that none of them is symptomatic, and when you're not symptomatic, you cannot transmit the virus. Very
important point there, and we've just been speaking about our ports of entry, especially the Jomo Kenyatta International Airport, with regards to about 68 flights from Western Africa coming into Kenya each week, and the kind of steps that have been put in place by the government to ensure that Ebola does not spread into the country. Dr. Otipo, just reassuring Kenyans that there is no Ebola, any case of Ebola that has been reported in the country. However, Jomo Kenyatta is not our only port of entry. Just take a look at some of the opinions of people from Malaba, which is another port of entry to Kenya. Of course, Uganda having reported a number of cases of Ebola about 2 years ago, I believe. Let's take a listen to that.
Tuko na wasiwasi kwa sababu ugonjwa sisi tunapeleka watu kutoka Kimaiti tunasonga paka Malaba huko, na ndiyo maeneo ya Ebola.
Hatujapata any cases. Sisi pia tumesikia tu kutoka kwa mtandao ya kwa kuna outbreak ya Ebola.
The government has sent out a circular to county health directors calling for surveillance at all border points. The intermingling between persons of various nationalities crossing into Kenya from Uganda now perceived as a threat by locals. Yet while the government maintains its position, on the ground there are several obstacles to overcome.
All right, just taking a bit of your feedback. Junior Omondi, you say that you're tuned in to KTN Africa Speaks with us. Thank you for joining us. Tell us what you think about the virus, and you can, again, join us and communicate with us on our hashtag Ebola and hashtag KTN Africa Speaks. I'll be reading some of that feedback a little later on in the show, but let's continue with this discussion. You've heard what the people at the border are saying. They feel rather insecure about the kind of steps that have been put in place by the government in terms of mitigating against Ebola. Is this the case as we speak?
No, as we speak now, all the health workers manning points of entry, including the border crossing points, are on high alert. As I mentioned earlier, immediately we received this information, the Director of Public Health sent a circular to all of them, informing them of the possible measures to take and how they should move ahead and control the situation in case we were threatened. Now, these health workers are well equipped, well trained, and they are screening passengers who are suspected to be originating from West Africa.
Yeah.
And that's why we have been able even to detect some suspected cases like what appeared on that first at the Jomo Kenyatta International Airport.
All right.
Yes.
But you know our borders, especially with Uganda,
Yes.
just generally borders across the African continent and communities living there, to them borders are rather arbitrary, and our ports of entry are rather few, even in Western Kenya. Are you absolutely sure that you can police, in terms of health, the entire stretch of the border?
For travelers who are coming from outside our neighboring countries, they have to go through the normal immigration procedures. So those who are going through the main immigration procedures are being taken care of.
Yeah, but we know that that doesn't happen very often. I mean, people can cross into Kenya from whichever point they're at, and that sometimes is not where the port of entry is located. That happens all the time.
Yeah, Alan, yes, that might seem like a concern on the surface. But knowing the system and the East African community, I wouldn't worry much about it. We have a very good networking between the 5 EAC member states,
yes,
where we have an organ where we alert each other, we notify each other immediately, but not later than 24 hours, whenever we suspect any unusual event. And we know that Ebola, by its very nature, wouldn't start happening and last for several days without us knowing. We will know very fast. And like we know, Uganda, Tanzania, Rwanda and Burundi, there have been no cases at the moment, and all of them we are communicating on a daily basis at times, and we know that they have also heightened their surveillance such that if there was to be any case there, then they will most likely have picked it up.
All right, how do you isolate a person, sorry, but I'll get to you in a moment, how do you isolate a person who presents with some of the symptoms of Ebola?
Well, when someone presents with symptoms that, first we have defined what an Ebola case meant to health workers,
yes,
might be like, what we suspect as an Ebola case. So when such a person presents to a health worker, we will expect that the health worker will notify the next higher level and the national level within 24 hours.
Yeah.
And then there are guidelines that we've issued out to all health workers through the county system, that you're going to look out for the following, and that if you encounter any case that meets this case definition, then we will expect you to do the following. One of them is actually isolating the patient or putting the patient aside from others, limiting access by health workers, because you want to limit how many health workers can access that patient just in case.
Yes.
Limiting access by family members, like you will have no family members in, and if any family member has to come in, then they have to wear appropriate medically provided equipment before they or clothing before they access the patient.
All right.
So we limit contact of that suspected case with the out environment, and then finally, at the same time, we also extract a specimen to our Kemri laboratories, which are very well equipped, and within 3.5 hours, we can be able to tell if that patient has Ebola or not.
Yes.
Then if the patient has Ebola, then we will take to a substantive isolation site where they will be managed without risk to health workers and without risk to the community at large.
All right, Mr. Makama, you had something to say, but very quickly, in addition to what you have to say, how quickly would we be able to react if a person is said to have presented with these symptoms?
Yeah, to start with, what I wanted to mention earlier was the collaboration within the EAC states is even mirrored at each of the border crossing points, because we have joint border management committees which comprise of officials from each side of the border. So in case there is any problem on one side, they'll be able to share the information.
Okay.
Now, on how fast we can respond, I think our response will be immediate. Our teams are trained on rapid response, and I think this was clearly illustrated when we had a scare at Jomo Kenyatta International Airport on the 31st.
Okay, thank you very much for that. Let me just read a bit of feedback. This is That's Sly Cougar, that's your hashtag. I hope that's not your name though. I'm tuned in, but I'm wondering, what is the genesis of Ebola? Where did it originate from? I'll just answer part of that question. Ebola, the Ebola virus was named after the Ebola River in the DRC. Am I correct, Doctor?
You're right.
Yeah. Now, what is the genesis? Very quickly as we wind up.
The Ebola virus naturally resides somewhere, and now science is pointing to some wild fruit bats. There are some bats that reside in the wilderness that and not all bats. So when you see any bat, you don't have to run away. It's a special kind of a bat.
Resident in which part of the continent?
Usually in Central and Western Africa.
Okay.
And a bit of East Africa, mainly Uganda, Budibungyo, and western part of Uganda.
Yeah.
And that's where we think the virus resides in nature. So the virus jumps from the bats directly to human beings when we invade the environment.
Yes.
Or to us indirectly through other wild animals, mainly the primates like monkeys, when we go running after them for meat. When you're processing the meat, then the virus jumps from the primates to us.
All right.
Then now the infection is then sustained in human populations from person to person.
Bushmeat, is that a bit of a problem? And for both of you, just to answer this as we conclude, how big of an issue is it in East Africa, eating of bushmeat? And because that is one of the areas that have been looked at by WHO in terms of the spread of this virus.
Well, luckily in East Africa, especially so in Kenya, we are not consuming a lot of bushmeat. In fact, it's a rarity.
Yeah.
Unlike in Central Africa and in West Africa, where anything that's moving in the wilderness is actually meat, and they run after it and kill it.
Yeah.
In Kenya, that's not much of a problem.
Okay. All right. Thank you very much for joining us, Dr. Shikanga Otipo. And Mr. Sami Makama, thank you very much for joining us from the Kenya government. Dr. Shikanga Otipo, of course, he is a medical epidemiologist, an acting head disease surveillance outbreak response unit from the Ministry of Health, and Sami Makama, head port services health unit, also from the government of Kenya. Just one more tweet that I'm going to read here before we wind up. Eric M at Slicky_RIC to KTN Kenya and Africa Speaks. How exactly is filling a form a preventative measure? He thinks that's a joke, but as Mr. Makama and Dr. Otipo have explained, that perhaps is one of the ways that we are effectively mitigating this. Just answering that on your behalf because we don't have much time left. Now, as we conclude Africa Speaks, we're going to be played out by a song very popular on this continent, but very resonant with what's going on around the world. The Israeli Defense Forces and Hamas have a 72-hour ceasefire. That conflict going on there with almost 1,000 people dying. And whether it's that conflict or the tensions that are currently in Malkamari in Mandera out of raids of cattle, the message from this song is the same. War cannot be sustainable. War, especially war between two communities where one thinks one is better than the other, should not be the case, especially in this day and age.